Losing the baby teeth can be a very big moment for the children as well as their parents, and every child responds differently to the loss of their baby teeth. Some are super excited about it because perhaps they have been waiting for the tooth fairy to come for a long time, and some could be a little bit nervous. My name is Swati Maan. I am a dentist, and my topic of talk today is what to do when your child loses his first baby tooth, what to expect, and how to handle the situation. Falling off the baby teeth is absolutely normal, and we all know that. This is happening because of the pressure from the permanent teeth, which are forming just below the baby teeth. Usually, you start seeing the wobbliness in the children's teeth from the age of around 5.5 to 6. But if it's delayed by a year or so, I wouldn't say that you need to worry about that. So if the age is around 7 and onwards and still you don't see any wobbliness or motion in the baby teeth, it's good to speak to your dentist. Maybe they will locate the permanent teeth with the x-rays and find out why the baby teeth are not exfoliating. If there is early exfoliation, similarly, if the teeth are exfoliating the baby teeth from the age of 3 to 4, that's an early loss of the baby teeth, which can lead to the early eruption of the permanent teeth, and that can lead to the crowding in the permanent dentition as well. So either way, if it's early loss of the baby teeth around the age of 3 or 4, or if it's a late loss of the baby teeth from the age of 7 onwards, in both situations, it's important that you speak to the child's dentist about that to make sure that things are going in the right direction. Now let's talk about what to do when your child comes to that moment of losing their first baby tooth. Well, bleeding is normal, so because there is a socket formation. Luckily, the socket is not very deep like a permanent tooth. It's a little socket because the tooth is already resolved. So to control the bleeding, use a gauge piece, dip it into warm water, or use a small towel, dip it into hot water, and try and compress the socket to restrict the bleeding. Repeat that after every few minutes and hold the socket there for around 10 to 20 seconds and keep checking. Usually there's nothing to worry and the bleeding will stop itself within half an hour to an hour, but keep checking and make sure that the socket is clean. If your child is in pain and if you see that no, this area is really tender and the child is unable to eat, the use of topical anesthesia will be really helpful. You can use Bonjela Junior or you can use Calpol Calgel. That can be used on the surface with a clean finger to make sure that the area gets slightly numb and your child is not in pain anymore. You can also give your child some Calpol liquid if you feel there's a need of that. Number 3, if you see a swelling in that region, because sometimes children try and shake their teeth too much when they feel the teeth are wobbly, which can cause some trauma in the surrounding structures and the area can be swelled as well. So in that situation, Nurofen can be used, the Nurofen liquid. But if your child is asthmatic, then of course you cannot use Nurofen. Then you can use Calpol to relieve the pressure and the pain from that region. Reinforcing a good oral hygiene at this stage will be extremely important because now you can motivate your child that the new teeth are coming. They have to look after their new teeth really well. Brushing twice a day, cutting sugar from the diet, making sure they start to floss gently as well is quite important. And it's a really good timing to talk about all this. As I said, it's nothing to worry. It's a very natural process. Every child reacts differently. And so we have to react with the child differently. So just make sure that you just motivate them, reassure them. Sometimes they can be a little bit anxious about it, but just calm them down. And probably an ice lolly or an ice cream as a treat will create some happy hormones and that will make them happier. So now the question comes, then when will we see the permanent tooth once the child has lost the baby tooth? Well, in some occasions, it could be immediate. So as soon as the child loses the baby tooth, you can immediately see those little spicules of the permanent tooth growing just underneath that, as if it was just waiting to come through. In many occasions, it could be around 6 months' time. So once the child loses the baby tooth, it can take up to 6 months' time for the permanent tooth to start coming up or to start showing up. And it can take up to 12 to 14 months for the permanent tooth to fully grow and take its position. While the permanent tooth is erupting and trying to come through, you see a little swelling in the gum in the form of a little bubble, which can be sometimes blue in color as well. So it could be really dramatic to see why this is swelled up like that, but that's absolutely normal. This is all happening because of the pressure from the upcoming permanent tooth. And as soon as the permanent tooth takes its position, you will not see that swelling and that will disappear. If you see your child being in pain or discomfort during the eruption pattern, you can always apply anesthetic gel, as I mentioned before, or you can also give your child Calpol. So it's nothing to worry. Trust me, the symptoms of the permanent teeth eruption is nowhere near to the teething process that your child went through when the baby teeth were coming through. It's just a sign of healthy growth. and that's all what we need. So yeah, this was my all talk about the baby teeth, how you see them growing, what to expect, and what to do. So if you like my video, please like it, subscribe to my channel if you like the information. And if you have any questions, feel free to drop any message in the comment section, and I will meet you in my next video. All the very best.